And thank you guys so much for listening. We've got a little bit of time here where we want to take questions. So for people in the room, if you have a question, there is a microphone that we'll bring to you. So just raise your hand or signal over to Lisa here if you have a question. And then while we're getting started with that, there are a few questions that we've received from folks who are joining virtually. So one of the first questions that was raised was actually in regards to the spasticity treatment. So I'm going to ask Dr. Sutton, if somebody's considering a baclofen pump, are there any concerns about increased infection risk if they're getting a baclofen pump?
So in terms of getting the baclofen pump, we have to make sure we know about the infection risks that come with the surgery. Other than that, after the baclofen pump has been placed, the risk of infection of that pump or that area is extremely low because we're not messing with it too much. When they're filling the baclofen pump with medicine, all of that's using sterile technique, and I've never heard of any of our patients having problems with infection from that.
That's excellent. Thank you. Yeah, with the surgery with the pump, what we always tell people is we got to keep that site clean, and if you see any redness around that area after the pump is placed, that would be something we want to know about right away. But luckily with really excellent care and recommendations, people do pretty well, and I would say that's a very, very rare thing. So another question, and again, feel free to raise your hand if you have questions in the room. Another question that we received was asking about vitamin supplements and if it's okay to just take as many vitamins or whatever you find over the counter. And I think that's a really good question. There are some vitamins where it actually wouldn't matter if you took as much as you wanted because your body would actually just get rid of them. But there are some vitamins that it could be dangerous if we took too many. So when we're talking about vitamin D today and how that is really important for your bone health and also immune health and that we think it has impacts on MS, that is one vitamin that we would just want to be careful about. So if you're taking vitamin D, you should definitely let your healthcare provider know what you're taking and how much you're taking. And your physician or nurse practitioner is going to want to be checking blood levels of that. You can have too much of a good thing with that, so sometimes it does overshoot a little bit, and that could cause some dangerous health problems. So we want to make sure you're kind of taking what has been recommended and then getting the blood work when your healthcare professional is asking for that. B12 is a different vitamin that if you took that one, it's fine. You could take as much as you wanted of B12, and there's no harm that's ever been reported with that. But it's always good just to bring up whatever vitamins you're taking so we know. Okay. Other questions? Anybody in the room have a question? Is there a question over here? Yep.
I have a few. But I'll start with one for Colleen. I was curious in any of your research how vaping came into the algorithm of treatments and just what effect that's having.
Wonderful question.
You're on.
Oh,
Yep.
am I on? Okay. For those who are online, if they could hear that question, the question is about in regards to vaping and what the research is. And at this point, I think the MS Society does have a stance that there probably there are negative effects, but unfortunately there is still some limited data in regards to, we have a little bit more data about smoking. I know obviously there's that, people think that vaping might be a little bit more benign, but again, I think that there's still some negative impact.
Okay. Any questions over on this side of the room? Yes.
I was wondering about leaky gut syndrome. I've heard or seen a lot about that online.
Yeah, so leaky gut syndrome. So, in regards to what we talked about today, or I guess relevance to MS, one of the things that's been discovered through research is, eating more of a pro-inflammatory diet or red meats, lots of processed foods, it increases the permeability of the gut and allows those pro-inflammatory components to be more present in the blood. And that certainly in studies looking at MS has been noted as being a potential driver of autoimmunity or even increased fatigue and overall decreased quality of life. But again, I can't quote you that there have been any specific studies specifically related to leaky gut syndrome in MS, but more that there's a more permeable gut barrier when you have that unhealthy bacterial makeup in your gut.
But once we change our eating pattern, or then that would resolve too?
So that's what's been proposed, that if you have a healthier diet, then you have less of that permeability in the gut, so you're not having promotion of inflammation systemically in your bloodstream. And so again, just that it's never too late to change. If you feel like you've been eating an unhealthy diet and you want to start working in that direction, that would be beneficial. Wonderful. Okay, well, one of the things, I'm going to actually just ask a question to Alyssa here. There are a lot of folks who tell me that they really want to exercise, but they're not sure how to get motivated. And one of the things that we find is that when they meet you or they meet one of our neuro PTs or OTs in clinic, oftentimes people feel a little bit more motivated. So what is it that you say to people
Literally everything I presented.
to get them moving? And could you comment a little bit on the wellness program that has been developed here, so that people are just aware of that?
Okay. Well, the first part, really everything I presented today. So it's really like you need to find your own internal motivation, but what she's referring to with the MS Wellness Program is currently at the Neuro Wellness Center, but it's a 12-week program, twice a week. It's a group of people that have MS and led by an exercise physiologist who is specifically trained and educated in MS. It includes educational topics. They do cardio, they do strengthening and balance. So it's getting all those components that are recommended for your exercise program, and then that accountability because it's twice a week for 12 weeks and you have a group of people waiting for you to show up. But I don't know how to answer that first part more than, yeah, go ahead.
I just wanted to add to that. Part of what we do in occupational therapy as well is managing and discussing mental health, and that's very obviously affected with a lot of people with chronic conditions, traumatic to experience chronic conditions. And something we've been exploring a lot is intentional goal setting and routine management and how we look at our routine and build in new healthy habits into routines. I gotta tell you, this is not really, I'm not sponsored by this guy or anything like that, but Atomic Habits is one of the books that I read recently, and I have found that a lot of my patients have really gathered a lot of information from that. So if you like reading, Atomic Habits by James Clear has been really helpful because it talks about how to take habits and implement them into your life to make them more feasible. It can just seem really big when you said, I just got diagnosed with MS. Now you're telling me I need to change my whole life and now I need to exercise, and that seems so big. And it's trying to make it a little bit smaller, more feasible, while also with us talking about intentional goal setting to include people in it. Making change is not easy. But it's necessary for maintaining a chronic condition. So something that I feel like is really helpful to address with a clinician, because again, that accountability piece, you got to show up to me and tell me how many times you exercised that week. That's why it's motivating. But we try to come up with the internal self-efficacy for you to be able to do that for yourself. So I think that, that's how I feel like I address it. That helps a lot. I don't know.
That's incredibly helpful, and that's an amazing book. I've read that book, and thanks for bringing that up because that's wonderful. One of the questions that came up virtually in regards to that was, I did the wellness program before, but it's been a while, and I really feel like I would benefit from that. Could you do the wellness program a second time?
I'm pretty sure Megan will not turn you away. I don't know what the current statuses of the different offerings, but they also did have like an advanced and like a more basic, I forget what they called it, but I think they have like continuity classes. So like the 12-week programs, like that initial introduction, but then continuing classes. But you can always reach out to the Neuro Wellness Center for further information, and especially the start dates for the different programs.
And there's been a attestation to the wonderfulness of the MS program, the MS Wellness program, by one of our participants in wellness, and he shared that it has been a huge quality of life component in his MS journey since 2016. So firsthand support there for that. There's a question here that I think it would be really helpful to hear from Dr. Sutton that someone virtually mentioned. I exercise regularly, but after I do, my leg is weak for about a half an hour, especially spasticity in the calf and knee area. Is there anything that can be done to help reduce this spasticity, or is it just waiting and resting?
Yeah, that's a good question. Sometimes we see that exercise can kind of temporarily make symptoms feel worse once you're done. So a lot of people notice that after they exercise, their muscles feel weak, or they feel more fatigued, or the spasticity comes back. And that can be a normal response to the exercise. It's just your body has to kind of overcome that challenge you just put it through. Some things that could help to prevent the spasticity after exercise would be doing the stretching beforehand and after. In certain cases, in patients who have spasticity that's really limiting their ability to exercise or work with therapy, we might even use a specific medication that they take before their therapy sessions to help them get through the session and feel well afterwards. But a lot of it comes down to those lifestyle things like the stretching programs and listening to your body too, making sure you're not overdoing it.
That's excellent. Thank you. So one thing that I just want to mention about while we're talking about exercise, we're really lucky today that we have Mindy Durr in the audience. She is back in the corner here. She can probably wave just so those of you who are here can see her. She's actually responsible for starting a program here at Ohio Health called For Hope. And this program is to help individuals who would like to continue or start playing golf after they have had a neurologic condition affect their lives or their function. She also now has her own program for that. And so I encourage you, if you're here, to stop by and talk to her after the program today, just so you can learn about it, because it's pretty cool. Maybe, hopefully, she can teach me how to be better at golf someday. And then also, if you join virtually, we'd be happy to give you her contact information as well. So at this point, I just want to really give a shout out and thanks to all of our sponsors for this program who made it possible today. They're all over in the room next door, so if you have a few minutes, we'd love it if you could walk through. I think there's some giveaways. There's candy over there, so stay away from that. This is a pro-inflammatory diet, but you can give it to your kids or grandkids. And then thank you so much for the sponsors. Thank you so much for our amazing IT team back here who's done a lot of hard work behind the scenes. They're amazing. I want to thank Lisa Counts, who has been instrumental in helping to coordinate this program today. And then I also really want to thank our Rocco, who helped with our sponsors, and then our amazing speakers. So I didn't realize it till today, but it was pretty cool to have an all-women panel. So I want to thank our neuro rehab experts, Alex, Alyssa, and then our incredible clinicians, Colleen O'Connell, who's been in MS longer than I have and has taught me everything I know, and then Dr. Sutton, who's been with us. So thank you so much, and it was wonderful to have all of you here today, so we really appreciate it.